So we're going to have a look at ACBT, which is active cycle of breathing technique. This is designed to help lift the mucus, the nasty stuff from the bottom of your lungs a little bit higher and make it easier to cough them up. If you cough too much, you'll get too tired and it will be ineffective and you'll make yourself feel more poorly. Before you start any of this, it's really important to be well hydrated, to make sure that you carry on drinking plenty. If you drink more, all of the mucus and the nasty stuff in your chest will be looser and it'll be easier to cough it up. If you're supporting somebody that needs to have additional fluid through a peg, but they're still able to follow this, then have a chat with your dietitian or your GP about giving them some extra fluid through their peg to support this. So what we're going to do to start with is going back to our nice deep breaths. So put your hand on your tummy, sitting up nice and straight, and just get some nice deep breaths to get the air going down to the bottom of the lungs. And when you've done a few of those and you're nice and relaxed, we're going to go into some holds. So you're going to breathe all the way in with the biggest breath you can. When you get to the end of there, you're going to hold it and you're going to count to 3. This is allowing the air to go behind the mucky stuff at the bottom of your lungs, and then gently breathing out again. You're going to repeat that 3 times. If at any stage you feel a little bit dizzy or lightheaded, just stop doing those, go back to your normal deep breathing exercises until you're feeling okay, and then you can restart again. And then the next stage is adding in Huff. This is going to enable you to lift some of the mucus from the bottom of your lungs up into the middle and make it easier to cough up. So what we're doing is taking a nice deep breath, breathing out a longer breath with an open mouth at force, as if you're trying to steam up a window. So after 3 of those, you can change the huff to a slightly shorter huff. This will help lift the stuff from the middle of the chest a bit higher. So this one is a shorter, sharper breath out, still with your mouth open. And once you've done all of those, you should hopefully have moved the secretions in your lungs enough to be able to cough more efficiently. Again, this is designed to make you cough, so think about your environment. If anybody that's supporting you needs to wear appropriate PPE, and have a tissue available if you need to cough anything up.